There are close to 2.5 million people living with this condition, and we spend $185 billion on the care for this disease. Plus, it's the 6th most common cause of death. All those numbers add up to one devastating diagnosis: dementia. Dr. Matthew Frantz is here with details. Dr. Frantz is in the family medicine at MetroHealth. Cleveland family medicine,
yeah,
I guess I was trying to say.
It's all good.
So when we say dementia, do you really mean Alzheimer's?
Well, Alzheimer's is a type of dementia. Dementia in and of itself has many different types of diagnoses. We have vascular dementia, which could be from decreased oxygen supply to different parts of the brain. There's dementia that can form from Lewy body dementia. It's a different type of dementia. Parkinsonism can cause dementia eventually. But dementia in and of itself, the majority of the cases, about 80% of them would be considered Alzheimer's dementia.
So what causes this dementia?
That's a good question. If we're talking Alzheimer's in and of itself, we have no idea what causes Alzheimer's to form. We do know that when you look at the brain, when they do tissue sections of the brain in people with Alzheimer's, we can see certain characteristics. They have these beta amyloid plaques between the nerve cells, and inside the nerve cells themselves, they have these amyloid spindles. And those are very indicative of Alzheimer's disease. In and of themselves, we don't know how they form or why they form.
Oh, yeah. So, but all of these dementia issues can come out. Now, if I can't remember where I put my keys, or I forget my grocery list at home, does that mean I have to be worried about dementia?
No, certainly not, because if it was a key issue, I would have had dementia at 16, or if you couldn't find your wallet.
Yes, my children would all have dementia.
Yeah, that's true. I think that there's warning signs for dementia, and the Alzheimer's Society does have those posted, and you can actually go to them, and we'll show you them here. But they're all forms of a loss of cognition, and cognition is your life experiences that you learn that help you make judgments or insight or reason and logic. There's different forms of memory. Where there's semantic memory, there's affective memory. Semantic is the first one that we lose, and it's your ability to do complex things. Read a map or do a recipe. The last part of memory that we lose is affective, which is sounds and smells and things like that that will elicit memory.
Wow. So there's all kinds of different symptoms. So if we see some of these symptoms, how do we treat this?
Well, first of all, treatment of Alzheimer's is to eliminate all the other indicator or the other things that may cause dementia or memory loss. So first, obviously we eliminate, we do a history and physical, and we look at all the causative things that we can treat, the combinations of medications, as we talked about before, the loss of circulation to the brain, the thyroid, hyponatremia, all those other things that we can fix. But as far as treatment of Alzheimer's disease, there really isn't a treatment. There are medications out there that will slow the progression down. And I think if you find out that you have someone that has Alzheimer's disease, it's very important to start those early, because that'll kind of slow the progression down so that you can keep them out of extended care facilities and keep them at home for longer periods of time. So, the diagnosis is made not only on the physical and history, but on memory testing and things like that we do for the...
Okay. And it's probably going to get more common, right? As people
Alzheimer's is...
live longer?
Yeah, well, as our population ages, as the baby boomers tend to get older. By 2050, now we have approximately 85,000 to 100,000 Alzheimer's patients, probably more. By 2020, we're going to have 600,000 more diagnoses a year, and by 2050, up close to 1 million new diagnosed patients with Alzheimer's.
So what can we do to try to hold it off?
Well, the things we can do is you take better care of yourself. Obviously, you can, you get your history and physical, you watch your diet, you decrease the amount of trans fats and fats in your diet. Maybe, there's say that vitamin E is a help. Decrease alcohol intake, get good sleep at night. Make sure you're taking better care of yourself. Be social. Don't lose that, those social interactions, because that's hugely important.
All right, so. Great advice. There's no easy way to say it. Dementia is a frightening disease, but there are proactive steps you can take. Just like your body, your brain needs a healthy lifestyle to keep in shape. So do it. Follow Dr. Frantz's advice. And if you're concerned, use the information that's coming up next to learn more. My thanks to Dr. Frantz for joining us today.
Thank you.
To learn more, call MetroHealth at 216-6 778-7800 or log on to www.metrohealth.org. Next,